Hi, I'm Lorenzo Fuccio. I am professor of gastroenterology at Sant'Orsola University Hospital in Bologna, Italy, and I have the pleasure to present you our article published in Gastrointestinal Endoscopy and entitled Clinical Outcomes After Endoscopic Submucosal Dissection for Colorectal Neoplasia, a Systematic Review and Meta-Analysis. In 2012, Repici and co-workers published the first systematic review on the efficacy and safety of ESD, including 22 studies, mostly performed in Asian countries. Since then, a large amount of studies has been performed both in Asian and non-Asian countries, and the current systematic review should be considered an update of the previous work by Repici and colleagues. As you know, the standard technique, which is based on the only use of the needle knife to dissect, is a very challenging, time-consuming and also risky procedure. Therefore, in the recent years, an alternative, less challenging, quicker and possibly safer technique has been proposed and called hybrid technique. This technique is based on the sequential use of a needle knife to circumferentially incise the lesion and partially dissects the submucosal plane to expose the lesion. After that, the dissection is completed by the placement of a large snare. So, the current study aimed also to systematically review the evidences on this hybrid technique. We perform an extensive literature search on the main electronic databases, which are PubMed, Scopus, Embase, Google Scholar, and the Cochrane Library up to August 2016. The studies selected were those studies including patients with non-pedunculated, non-carcinoid colorectal lesion treated by ESD and providing the R0 resection rate. We included both retrospective and prospective studies published in English as full text or abstract and including at least 10 patients. Primary outcome measure was the R0 resection rate. The key secondary outcome was the need for surgery due to ESD-related severe adverse events. Several other secondary outcomes were also evaluated, such as the en bloc resection rate, the bleeding and perforation rates, and also the post-ESD recurrence rate. After applying the selection criteria, 109 studies were considered eligible and finally included in the systematic review for a total of 19,400 dissections evaluated. In 97 studies, the ESD was performed by the standard technique, while in 12 studies the hybrid one was used. Let's start with the ESD standard technique. Overall, the pooled R0 resection rate was 82.9% with an en bloc resection rate of 91%. However, as expected in a systematic review with more than 100 studies included, the heterogeneity between studies was very high. Therefore, we investigated it by both subgroup analysis and meta-regression analysis, and we observed highly interesting findings coming from this analysis. Indeed, the subgroup analysis performed according to the country where the procedure was performed showed that in non-Asian countries, namely Europe and North America, the R0 resection rate was 71.3%, which was significantly lower than that observed in Asian countries, which was 85.6%. Doubtless, the number of ESD performed per year has a major role explaining such results. However, when we stratify the data according to the volume of ESD performed per year per center, we found that high-volume center, defined as those performing more than 2 ESD per month in non-Asian countries, still continue to present significantly lower R0 resection rates than those observed in Asian countries. Another interesting finding came from the meta-regression analysis, which suggested an inverse association between rectal location and R0 resection rate. Indeed, increasing the number of ESD performed for rectal lesions resulted in a significant reduction of the R0 resection rate. Based on the results of our systematic review, ESD should be considered a safe procedure. Indeed, the risk of severe adverse events needing surgeries was overall 1.1%. However, once again, we observe significant difference between Asian and non-Asian countries. Indeed, in Asian countries, the risk of severe adverse events needing surgery was 3.1%, while in the Asian countries, this risk was about 0.8%. The meta-analysis of the 12 studies evaluating the hybrid technique showed almost disappointing result, with a pooled R0 resection rate of 60.6% and an en-bloc resection rate of 64.5%. When considered the safety of this procedure, we observed that the overall rate of adverse events needing surgery was about 1%. In conclusion, in the current systematic review and meta-analysis, we have shown that ESD performed with the standard technique is an effective and safe procedure, at least in Asian countries, while in non-Asian countries, namely Europe and North America, there is room for improvement. We believe that there is not only an issue related to the volume of procedure performed per year, but also strictly linked to the training process that should be considered. ESD for rectal lesions should be performed by non-experts only in highly selected cases and possibly with the presence of a senior expert endoscopist. Based on the available evidence, the hybrid technique seems to represent an alternative to EMR, but is certainly failing to achieve outcomes similar to ESD performed with the standard approach. Therefore, the hybrid technique should be avoided in cases of lesions highly suspicious for superficial malignant invasion and should be just considered as a rescue strategy in case the standard approach is not feasible or fails. Thank you for your attention.